Hey everybody, quick video and a check-in. It's been a little while. I'm not making enough videos, but here's the deal. You know, a lot of people are like, this one's a good chiropractor, that one's a good chiropractor, good, it's like a misnomer, almost to like say good chiropractor, because I think there's a lot of people that are fine chiropractors. Then there are some even within the chiropractic profession that we call like amazing chiropractors, and it's like the best adjustment I've ever had chiropractor. And, there's sort of like what really defines a good chiropractor. And I want to just kind of give a little bit of my own insight and my own experiences in the last few weeks, and I'll tell you what I think. In a nutshell, a good chiropractor, in my opinion, is somebody who is able to rise to the occasion when a person that is suffering needs it most. So again, can you deliver the adjustment when somebody needs it the most? And I don't mean that if you blew out a disc, the chiropractor adjusts you and you're walking just fine, because, that just doesn't happen. Even when you see it on YouTube, that person's been suffering for a very long time and the inflammation has already gone down to a particular level to where they could handle a correction. So I want you to keep that in mind, because that's one thing I have a lot of experience with over the last, 3.5 years is disc herniation, disc bulge, discogenic, lower back pain related cases. Hopefully we don't get crushed here. And, that is a fact. Nobody's going in there with a hot disc that they had a day ago, completely antalgic, just unmedicated, and can receive like a game-changing adjustment like on the spot. It usually will take an adjustment or two that kind of begin to move the joint millimeters in the right direction. And when that pressure comes down and that inflammation comes down, really is what I should say, then, as Dr. Gonstead used to say back in the day, the bone is ready for setting. But to summarize my point, it's those chiropractors that rise to those occasions that I think are going to be perceived as great chiropractors and lifesavers and miracle workers, when the patient, no matter if it's me, another chiropractor needing the work, which I'll get to in a minute, or you out there as a patient who doesn't really care about all the other science involved in chiropractic and what the accolades are and what technique someone does, is can you get me better? How long will it take and how much does it cost? So for me, I have been just dealing with some things. A lot of it, again, is like motion sickness, feeling dizziness, what I believe to be associated heavily or is actual cyber sickness. And I do believe that there's a component of long haulers associated with this, or maybe reaction from a vaccination. So this unfortunate set of symptoms that I am dealing with, I really want to say thank you to the chiropractors who take care of me in my time of need. And I'm not the easiest patient to deal with, but they rise to the occasion, and it doesn't mean it's the best adjustment every time that gets me stable. But what I always talk to my patients about is through the combinations and patterns and their knowledge of anatomy, physiology, neurology, we get it done. And again, I really do believe that the message is clear, that can you rise to the occasion as a chiropractor for when the patient needs it the most? And then in my eyes, that is what a good chiropractor or a great chiropractor is and what they do. All right, I hope everyone is doing their best to live their best, to feel their best. And until next time, everybody, it's Dr. Pearlman.